He makes people like me happy. Young people like you happy. Makes people like me happy. Makes people you see
Thank you for joining us for another edition of Conversations with AARP in the Virgin Islands. I'm Troy Deshabir Schuster, State Director for AARP in this territory. At AARP, we remain committed to fighting for rights and well-being of older Americans for more than 60 years. Since our founding, we have been at the forefront of arming consumers to fight back against fraud. Our efforts in preventing and educating the public about fraud, especially Medicare fraud, have been at the pinnacle of our advocacy. Since its enactment in July 1965, Medicare has been a favorite target of scam artists. As early as October 1965, AARP was already reporting on scammers posing as representatives of the Social Security Administration, attempting to defraud older Americans by offering them special discounts on Medicare premiums. Sadly, Americans were paying scammers and not the government. In the early 1970s, such scams were estimated to cost Americans about $4 billion a year. Today, the impact of Medicare fraud is even more staggering. According to a recent report from the Center for Medicare and Medicaid Services, CMS, taxpayers lose more than $100 billion annually. This alarming reality further underscores the importance of raising awareness about fraud. Today's episode will not only inform you about Medicare fraud, but also provide you with practical tools to help spot, protect, and prevent fraud against yourself and your loved ones. To help us navigate this topic, we have invited Jennifer Logie, Senior Medicare Patrol Project Director at Legal Services of the Virgin Islands, to help us understand and take a stand against Medicare fraud. And so, Jennifer, we welcome you to the show.
Thank you. Good morning, and thank you for having me.
A pleasure. Thank you for taking the time to be with us today to talk about this important topic of Medicare fraud. It's happening everywhere, including right here in the Virgin Islands. Medicare fraud has many faces, many facets, and can come to us from a variety of sources, from the scammers on the telephone, right, to even physicians, even healthcare providers.
Correct.
So before we get into the topic, tell us a little bit about your agency and where it sits. We mentioned Legal Services of the Virgin Islands. So tell us a little bit about how your work or how the work of your department fits in with Legal Services of the Virgin Islands.
Well, the Senior Medicare Patrol, what we do is we empower Medicare beneficiaries, their families, and caregivers on how to protect, detect, and report fraud. In the Virgin Islands, the Senior Medicare Patrol is administered by Legal Services of the Virgin Islands. And we are in partnership with a network of territory wide aging agencies. We are a federally funded program, and we are funded, sorry, by the Administration for Community Living. So we are in 50 states: Washington, D.C., Guam, Puerto Rico, and the Virgin Islands. And also, the Senior Medicare Patrol, we're in partnership with the Department of Health and Human Services and the Department of Justice to help fight Medicare fraud. So, we're pretty big
That's
statewide.
wonderful. And so your work covers the entire territory,
Correct.
but you are on St. Croix.
Yes. So I go, St. Thomas and St. Croix, St. John, sorry, and we do outreach events on all three islands.
Excellent. I'm sure that you get a really good response from the public when you do outreach events.
Yes, it's something new and refreshing to a lot of them because we realize that a lot of seniors, they don't read the medical summary notice. They're not aware of what they need to look for, and so us being out there is just refreshing to them. It's something new and exciting. So And a lot of them have even called and said, they learned so much on how they have saved money. So we're doing, very well in educating them in the community.
Excellent. So tell us, please, or explain to our audience what Medicare fraud entails and why it is a significant issue for older adults.
Well, you said it a little earlier in your introduction when you talk about Medicare. And Medicare loses an estimated 60 to 90 billion, that's what it be, a year. And that is what is reported. So we're actually looking at 90 to 100 billion dollars. So I often ask the question, whose money is it? And it's our money. It's them, the Medicare beneficiary, and it's us, the taxpayer. So when we try to explain to them how it affects them, you know, what does that mean for our Medicare beneficiaries? It means higher out of pocket costs and waste money that could be used to improve and to provide them with better health care. And what does that mean for us, the younger folks? It means the life of the Medicare program. So when we get to that beautiful age where we should be enjoying good health care, the Medicare Trust Fund is at risk. So, it's really important that we know enough so that we can all do our part, to prevent Medicare fraud.
I like what you said that it's about us younger people as well, right? A lot of younger people under the age of 65 or under the age of 60, they think, well, that's not my problem. I don't have to
Hmm.
worry about it. But like you
Correct.
just said, this fraud, these scammers affect the life, the longevity of the program, and will
Hmm.
affect us as we reach the age where we hope to become Medicare beneficiaries.
Correct.
And
Right.
in your community outreach, are you able to do outreach to the younger population to educate them
Well,
regarding this?
well, when we do our events, we usually not only invite the Medicare beneficiaries, but we invite the caregivers um, and the families. But recently, with my affiliation with legal services, our connection, what we've been doing, we've been invited to do a lot of events for government employees, so that they can be aware of what is happening. Because what is happening now, we have a community where we are caring for our elders.
Mhm.
And, some of us are maybe tossed into it. And so they also need to know what they're looking for, so we target everyone because it affects all of us.
Especially caregivers. I like that you brought up that point that a lot of younger people are caregivers these days.
Hmm.
You know, caregiving is at an all-time high and
Yes.
and is increasing
True.
especially among family caregivers as our population continues to age and as the population of the younger demographic
Hmm.
as age continues to, pardon me, I'm tripping myself up, as that population of a younger demographic continues to decline, right?
Right.
We have fewer and fewer younger people and more older
Older
people,
people.
and more people are becoming caregivers. And that's one of the main works of AARP, to support caregivers through our advocacy and through our community outreach. And so, going into the future, we'll hope to do a lot more work with you and your agency to protect the older population and to inform caregivers so that they can be a really, really great support. And so tell us a little bit about some of the scams that you are hearing and seeing. What are people reporting to you?
Well, some of the common scams we have in the Virgin Islands, we have Medicare card scam. So they're calling seniors and saying, "Well, Medicare has a new card. There's a chip in it. It's not like the paper card. You just tap it and so forth." So a lot of seniors are getting excited about this new card, and we tell them all the time there is no new card. A couple of years ago, there was the card with your social security number on it, and this, you probably remember that from your grandparents. And it was so much fraud with your social security number. So now they created this unique number. So that's one of our big scams we're getting. um, we have spoofing, and I'm sure you've heard of it. Us young folks are more up with stuff, but it's where they most of our seniors have smartphones, so they're now altering, the scammers are altering your number. So let's say you go to universal healthcare and you look at your smartphone and you're seeing universal healthcare, so you're like, oh, the doctor is calling. Well, the doctor is not calling you. So we try to tell seniors, when they start engaging in conversation and want your personal information, stop. Because if they're calling from Medicare or they're calling from the doctor's office, they already have your medical records.
Yes.
Okay. And the third scam that's really, it's big in the States right now. It has not affected, I've not heard it affected any of us, but it's medical identity theft. And this is where they are calling, offering our seniors free services, as you mentioned before, free energy drinks, nutritional drinks, and so forth. And what they're doing is they're collecting your Medicare number. So I often tell seniors, if somebody steals your credit card, they have about 3 days before you or the bank realize that there is fraud. But if somebody steals your Medicare number, they can sell it over and over and over again. And what they're doing, they're selling your number to a company that is signing you up on hospice. So most people must know what hospice is. It is end of life. So when you are on hospice, you do not get any type of curative care whatsoever. So imagine that, you are sick, you feel pain, you go to the hospital. When they run your Medicare card, they're going to send you back home because
Wow.
you're supposed to be, in a comfortable place waiting, you know, for your maker. And here it is, you're saying, well, it's not me. Well, this is what is happening. So now you have to either pay for the services yourself or you can fight to prove it's not you. So anyhow you take it, anytime there is fraud, error, and abuse, there are always consequences for our beneficiaries. So you have to stay vigilant.
That is an amazing story about how they're using your identity to sign you up for hospice care. That
Mhm.
is amazing.
Scary.
That
It is.
is scary. I mean, of
Hmm.
all the possible frauds, so they're registering you as a hospice patient, and then you can't get the services that you need because you're not a hospice patient.
Hmm. And I think they're charging hospice like 5,000. They charge Medicare about $5,000 a month for hospice services. So imagine they sign up 200 people on hospice, 300 people. You can imagine how much money that is um, for the scammers.
Right, right. And going back again to what you said about calls, I always told my mother, don't ever talk to anybody on the
Anybody.
phone who says they're calling you about Social Security or Medicare
Mm-hmm.
or IRS or anything. They don't call.
Call.
They don't
Mm-hmm.
call. And this is really important for our older population to understand, and for our younger viewers and listeners to tell your older
Yeah.
loved ones, whether it's your parents or your grandparents or your aunt or your uncle,
Mm-hmm.
don't ever have conversation with these people on the phone. I always told
Right.
my mother that when they call and started to ask her any questions, I told her just say, "Well, give me your number. My son
And
will
call you
call you
back.
back."
Correct.
And then right away they'll hang up,
They
right?
hang
They'll
up.
never leave a number. They
No.
don't want to call back from her son, right?
Right. Mm-hmm.
And then right? But no, again, please, our listening and viewing audience, please keep in mind that the Social Security Administration, that Medicare or CMS, that the IRS will never ever call you on the phone. They will send
Mm-hmm.
you a letter in the
Letter.
mail, and it'll be an official document from them, and then there may be a callback number there for you to call them, but they will never call you. So do
Correct.
not entertain any conversation with
Conversation.
anybody claiming to be from Medicare or Social Security or IRS.
Mm-hmm. That's
And
correct.
so, tell us what role does education play in preventing Medicare fraud? I mean, we talked a little bit about it already, but if you can go deeper, and how is the Senior Medicare Fraud Patrol working to raise awareness among older adults? It's and very specific. You mentioned already your outreach to the community, but can you give us some more specific details about where people can encounter you and so forth?
Well, when it comes to Medicare fraud, education is the key to preventing Medicare fraud. You see, if you are not aware of how something affects you, you don't think about it. You don't, pay attention to it. But when you know how something directly affects your life and your health, now you have a vested interest in protecting yourself and your benefits. So at the Senior Medicare Patrol, we educate our beneficiaries on what you do and what you don't do. Like, for instance, you do not give out your Medicare number except to a provider or a doctor or Medicare provider, and you do not walk with your Medicare card unless you need to use it. And that is so interesting because at every event, 90% of our seniors have their Medicare card with them. And if your bag is lost or stolen, what happens? you know it's at risk. And then what do? You treat your Medicare card like it's a credit card. It is that important. You watch out for medical identity theft, like we talked before. They're trying to get your number. And remember that, watch out for offers for free services. Somebody's going to clean your house once a month, or they'll provide you free nutritional drinks. And last, remember, and you just said it, Medicare does not call or visit to sell you anything. you know and we also teach them how to read their medical summary notice, and what to look for and how to suspect fraud. So that's kind of a lot of the events that we do. Recently, within the last year, we've had the Senior Medicare Patrol did outreach events territory wide. We did the Senior Conference on Aging, and we did St. John, St. Thomas. We just had St. Croix a few months ago. And we do we actually did a faith-based community earlier this year. So we did the Senior Financial Health and Wellness Conference, and we did that to target our faith-based communities. So we did the Adventist churches. We did, and we had it in one location. We had the Wesleyan Holiness, and we had the St. Anne's Church, and it was well attended. It was well received. And the 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 reviews was just so rewarding, because a lot of seniors really had no clue that this was happening. So we continue to do stuff territory wide.
That's very good. I'm glad to hear that. And how do people find out more information about where you will be in the community if you're going to be
Well,
at an upcoming event or putting on an event?
what we do is we post it on our Facebook page, at Legal Services, and sometimes we have it in the newspaper. We have flyers, to different organizations and so forth. So we do promote it so they're aware of what is happening, and we do the WhatsApp and so forth.
Yeah, so again, for our audience, please do check out the Facebook page of Legal Services of the Virgin Islands for more information as to where the Senior Medicare Patrol will be appearing out in the community, or you could even just get in touch with them directly through Legal Services of the Virgin Islands and get in touch with Jennifer Logie there, our guest today, and have your questions answered and your concerns looked into. And so, do you have volunteers who help you with your outreach?
Well, we do have a few, but we are always looking for more volunteers, and just trying to get seniors to understand Medicare fraud so that they can stay active in the community and educate others. It's been a little challenging, I must say. But we're getting out there. People want to know more, but we're getting them where they want to know more for themselves. So we are trying to encourage them. We speak extensively on it. We offer a lot of information. We even educate you. We give you computer classes if you need to. So whatever it is, or whatever role they would like to have, we make sure that we equip them with the knowledge that they need to be a successful volunteer. But we do have a few, and we're always looking for new and local volunteers to assist us.
Great. Well, I encourage everybody to volunteer. Of course, at AARP, we're always looking for volunteers
This
too,
as
but
well.
uh, Legal
Yep.
Services of the Virgin Islands and the Senior Medicare Patrol, they do great work, and we certainly support them in the work that they do to help to prevent Medicare fraud. And so, Jennifer, tell us about the Medicare summary forms.
Well, this is one of my greatest challenge, really. And when you look at the medical summary notice, the first thing you see, it says it is not a bill. And if you know anything about Caribbean people, if it says it's not a bill, we don't read it. So that has been my greatest challenge, to get them to read their medical summary notice. So we educate them on what to look for, your date, the dates of your service. We The Senior Medicare Patrol, we created the My Healthcare Tracker, and this tracker has the dates, the provider, what services you had done, and we teach them how to use it in conjunction with your medical summary notice so that they can best detect fraud. And I'll give you an example of that. Let's say last month you went to the doctor, you had a cold. So you went in, he saw you, and he gave you a prescription. But when you got your medical summary notice, you notice you were charged for x-rays and labs and stuff that you didn't get. You're like, okay, hold on. You go back to your summary notice. I did not get that day. So that's how easy it is to detect it. So at our events, we give out these My Healthcare trackers, and we teach them how to use it so that they're better able to detect fraud.
Yeah, and that is very important. And I must admit that, I mean, I'm not on Medicare, but even with my healthcare insurance, sometimes I
Mhm.
don't take time
You
to
don't
read
read it.
those forms
Right.
carefully, those summary forms. But yes, it is very, very important because, I mean, first of all, there's human error, right? Physicians
Mm-hmm.
or physicians' offices, their billing department could make a mistake. Sometimes
Mm-hmm.
that may not be a mistake,
Right.
so we do need to be very, very vigilant. And
And
so, go ahead, Jennifer.
and I'd like to share a story. Recently, I was in St. John, and I was teaching the seniors at Bellevue how to read your medical summary notice. Well, a lady called me recently. She said, Miss Logie, she told me where she was from, and she said, "Thank you for, teaching me how to do this," because I gave out a little highlighter so they can highlight, any errors that they see. And she was telling me that she had a surgery 2 months ago, and the doctor charged her 950 something dollars. But when she saw her medical summary notice, because now I taught her how to read it, so she's reading it, and she noticed that Medicare and her secondary provider paid the money. So she said she called Medicare, and they told her it was paid. She should, get her money back. So she's calling the doctor's office to get her $900 back.
Ah,
So she told me, she said, had we not taught her that, she would have not looked at it, and the doctor would have been paid twice.
right?
So it is important to read your notice.
Very, very important. AARP at its heart is an advocacy organization. We do an amazing job lobbying everywhere from Capitol Hill to every state and municipality across the country. And with that in mind, tell us, how can the advocacy work of AARP align with the efforts of the Senior Medicare Patrol to help to raise awareness and prevent Medicare fraud?
Well, it's interesting that you mentioned that, because we have been in conversations with AARP to collaborate with AARP Legal Services and some of the community partners to create anti-fraud and elder abuse workshop. So it is in the making currently, and so we are working together to little by little see how we can make a difference. So, I would say, please, keep your ears open. It will be coming shortly.
Yeah, and we look forward to working with you on this project. It's very, very, very important. And for our audience, every AARP workshop, every AARP community outreach event, every AARP event in general is free to the public,
Hmm.
whether you're a member or not. Please do come. Follow us at AARP Virgin Islands on Facebook, or aarp.org/VI on the internet. We also oftentimes put ads in the daily news, but most of our information is on Facebook and on our website. Please do follow us there, and please do come out to these events, because this is a way in which we partner with organizations like Legal Services of the Virgin Islands and Senior Medicare Patrol to educate you, and also to listen to you, to listen to your concerns, to listen to what you are experiencing, then we can further improve our education and our outreach, and maybe even come up with legislation and advocacy before our legislature and our governor to bring about changes in policy and bring about a real lasting change for the older population. So please do engage with us at AARP. Also, with Legal Services of the Virgin Islands, a great organization that does good work for our older population, our population in need, our most vulnerable people, and especially with regard to preventing Medicare fraud. And so, Jennifer, we have just about 3 minutes left. Is there anything else you want to let us know about your work and how people can engage with you?
Well, what I do want to say, because I know you deal with a lot of caregivers, and as I said, they're playing an active role. Um, Sometimes when you look at your medical summary notice, I don't want you to think it's instantly fraud. Sometimes it's a mistake. So what we do, let people know, is that you can call your Medicare provider and said, hey, I saw this, I didn't get it, and I need it fixed. And if you're not comfortable calling them, you can always call 1-800-Medicare, or you can call Legal Services, Senior Medicare Patrol, and our number is 340-718-2626 or 340-774-6720 on St. Thomas. And when you call, just have all your Medicare information, and we will be more than happy to help you.
Yes, great. And as I just prior to the show extended an invitation to you, we look forward to having you show up with us at our community outreach events more often in the future, because oftentimes people do come to AARP and ask us for all kinds of information on Medicare. Again, for audience, we are not an insurance company. We do not sell Medicare insurance. We do not sell even the Medicare supplemental insurance that's provided by United Healthcare. So if you have any kinds of questions about AARP branded supplemental Medicare supplemental insurance, please do visit the VI SHIP office, which is in the Wang F. Louis Hospital here in St. Croix, and then they have an office in St. Thomas as well, VI SHIP. Also, if you have any concerns about Medicare fraud, please do contact the Senior Medicare Patrol at Legal Services of the Virgin Islands, and they can help you with all of your concerns about Medicare fraud. And so, if you do call us at AARP, you do come to ask a question, all we can do is point you in the right direction and answer your questions for you. AARP, we're a social mission organization focused on advocacy and community outreach. So we really want to help you educate our community, and so forward to working with you, Jennifer, in the future to get that information out there even more and more, and to be even more present in the community, and we with you as well. So let us know how we support your work, because we don't want our senior population to be defrauded in any way. We want everybody to be well informed and everybody to be safe, especially safe financially. Because not only does it harm, in many cases, the Medicare system itself, CMS, but it harms individuals. I mentioned that one lady who would have ended up paying twice, right? Her Medicare would have paid, and she'd already paid, and now she's trying to get her money back. Thankfully, she'll get her money back from the physician's office. But it's really important to be vigilant and on top of all of this. So, Jennifer, we've come to the end of our show. Thanks so much for being with us, and we look forward to having you on a future episode of Conversations with the Virgin Islands.
Thank you. Thank you for having us.
Pleasure.
AARP.